Well, welcome to our vodcast. I'm joined today by Dr. Matt Tovey and Martyn Perry. I'm Steve Martyn. I'm the Chief Nursing Information Officer for the Trust. Matt, did you want to introduce yourself?
Yeah, thanks, Steve. I'm Matt Tovey. I'm a consultant forensic psychiatrist and the Chief Clinical Information Officer for the Trust.
And Martyn?
Hey, thanks, Steve. So I'm Martyn Perry. I'm the Associate Director of Digital Transformation for the Trust. Thanks for having me.
Brilliant. It's great to catch up with you guys, and we're here obviously to discuss the digital strategy and how we can impact the lives of our staff within MPFT and also the patients. So Matt, did you want to start with your thoughts on the digital strategy and how you think how valuable it's going to be? And I guess first of all, what is a strategy? And what is this? What does this digital strategy bring to me as a nurse and bring to me as a workforce?
Yes, so I suppose the thing to say is the Trust Midlands Partnership Foundation Trust released its digital strategy covering the next 5 years on the 30th of September this year. And it's an action plan, essentially, that brings together our aspirations for how the Trust is moving forwards with relation to kind of digital technology in healthcare. And we'll move on to speaking with Martyn in a moment, who's the architect behind this. But essentially, there are three key components: digitize, connect, and inform. And the aims are to look at the processes we currently have, make them digital where that's appropriate to do so. And the aim of that is that it makes working lives easier for our staff, makes things more efficient, connect services together, connect the Trust to our patients better. So we may think about how we can work more remotely in communities. And as you'll both be aware, but our audience might not, our Trust covers a massive area, some very kind of urban areas and some very rural areas. So we have that challenge to contend with. And inform. So this is about using the data that we can collect from our systems to provide better healthcare going forward. So that's certainly how I see it. And I suppose, I'd like to move on to Martyn, as I say, is the architect of this, and ask, why do you think we need this, Martyn? Why now?
Oh, yeah, cheers. I think just really briefly, I think what we had originally before such a robust strategy was a transformation plan, which was originally going to be from 2020 to 2025. And then we didn't have a really deep and meaningful strategy at that point, but we had a really good understanding about the technical requirements for the Trust, what systems we wanted to explore, what things we wanted to put in. And that stood us in really good stead for our COVID response, because when COVID hit, we went, well, actually, we need Microsoft Teams. That was already in the plan. But rather than trying it out on a single team, we're going to try it out on 12,000 staff by tomorrow. And that was something which really helped us respond really quickly. And then we took a step back following COVID. We had time to catch our breath and think, actually, right, we really need to project what our strategy for this is for the next 5 years. And what that is just around our mission, which is enhancing care through digital innovation. So what digital innovations are out there, not just technology, but what do our staff and service users want and need? What are the problems that they're facing every single day of the week that we might not be aware of because we're not really talking to those staff facing those issues in a really deep and meaningful level? We wanted to aggregate all those stories up, all that listening that we did, all that active listening that we undertook through the consultation of the strategy, to a really meaningful, tailored, as Steve said, action plan for the Trust. What are we going to do? You said there's an issue here. What's our ambition to address that issue, and how are we going to do it? And that's exactly what the strategy is. Over 200 full pages, essentially, covering all areas of the organisation and over the next 5 years. So that's why I think it was really important. It was that COVID response going, actually, we've got a good plan, but we don't really know how the benefits are going to manifest itself for service users and staff directly. Have we thought about all of these? And through this strategy, we've got a really good idea about how that's going to play out for everyone and what the benefits might be.
I think what I really like about the strategy, Martyn, and I know there was lots and lots of engagement you had in the development, and I think it shows, is that inclusivity within it. You've gone every corner of the Trust, engaged so many different clinical staff, corporate staff in the development of it, and I think it really shows. And I think the big thing, I think about from my experiences with digital technology is this, first of all, it's how often does it crash? We talk, how often does a system go down? And I think the digital strategy clearly articulates plans to address that. Also, we have multiple passwords. As a clinician working on a ward or working in any setting, trying to log into lots of different systems is a real challenge, and it puts a barrier sometimes in getting to the person that counts, the patient. So I think it encompasses that as well. But I think going on about the infrastructure and the importance of getting the infrastructure working well, I think is a key starting point. And I think what the strategy does is it sets out that is the starting point. It's perhaps the innovation comes a little bit later. And perhaps if we could touch on that, how you came to that, Martyn, and perhaps Matt, how did we get to that point where we found that actually there's some work to do with the infrastructure?
Yeah, I think I'll start if that's all right, Matt. Just really, really briefly, we did a maturity assessment for the HIMSS, which is a nationally recognised maturity, internationally recognised maturity standard, and we came out as really quite mature with a level 5. Really happy with that. But what the net result of that means day to day for staff came out loud and clear in the strategy. And I didn't want to shy away from the negativity that surrounds some of these areas. I didn't want to pretend we were more mature in certain places than others, and try and obfuscate some of that reality. I wanted to actually lean into that and go, if staff aren't happy with our IT reliability, 65% of staff aren't, and that's loud and clear in the strategy, put it out there, say that's what we've got to address. And so really the engagement, 100 hours of it, time and time again. It's tricky to connect in the community. We find that the systems go a bit slow when you're trying to log in the morning. There's too many passwords. You only need to hear that 5 or 6 times and the amber flags start waving. And then you hear that 150 times and the red flags start waving. You think we better do a survey on this and really ascertain what's going on. And the survey comes out and tells you the story loud and clear. 65% of staff aren't happy. Okay, first things first, let's make the trust aware of that formally through the strategy. Let's get the investment right to address it over the next 5 years. And let's make sure that we start on that and really manage expectations by going, okay, let's divide our transformation plan into some clear phases: foundation, process, innovation, and then the digital vision. So you're really just managing expectations over those 5 years. And innovation is happening at the same time as foundation work. It's happening throughout, but the quantity of that innovation we anticipate is going to increase as our foundation, our infrastructure reliability improves when we get the investment. And just, that sounds like a lot of words. So just really basically, real practical thing is wireless. Wireless came out, the wireless is bad.
And I think if we get the infrastructure right, that's a great starting point, isn't it, for all digital innovation? Because I know as a clinician, if something doesn't turn on once or twice, you walk away from it. And maybe Matt, I don't know whether you share that opinion, but if something doesn't work and you've got a patient in front of you and you're doing a consultation and you can't log on, what do you do?
Yeah, it's incredibly frustrating. And I suppose that leads me into something that we've discussed before, and that's kind of staff well-being and staff satisfaction. So we hear that staff aren't always satisfied with systems, but this is not just a problem in MPFT. Nationally, we have a big problem now in healthcare staffing. So and this is 5 years. What do we think we're doing now that's going to help staff to feel like MPFT through digital is the place to work, that they'll want to come to work here because actually we're making their lives easier through digital? Is that something that has been considered in the strategy?
I think that's a really good point. I mean, personally, I think, from a nursing point of view, I've spoke to nurses, and some nurses have actually joined the trust because of our EPR system we have in place, because of its maturity in comparison to other trusts. Because we know if we make the, health records, the electronic patient record more easier to use, we know that staff working lives is better. So it makes a real difference. I think also some of the things that we've brought in, the wireless connectivity and the community working through Rio Mobilize, etc., has made a real difference. And we've actually had the feedback from front-facing staff that actually it makes their working life easier. And these are things I think that we're doing well, we're doing right, and we need to build on, because it's closing that gap as well between we know that we've got a shortfall of staffing, whether it be nurses or any healthcare staff. But what we can do is really try and close that gap and make that working life easier. And also, it's around closing the gap between. We know we're getting more and more staff that perhaps aren't as experienced as before. So how do we close that gap? How do we work with people? I think the digital strategy does give a direction of travel in addressing some of that. I don't think we can address the staffing shortfalls, but we can certainly make work a lot more streamlined through digital innovation. And some of the things that I've just mentioned, I think, are heading that way. So I'm really pleased with some of the stuff we've done, particularly over the last 12 months, really. I don't know whether you want to build on that, Martyn, or any thoughts on that.
Yeah, I think the Rio Mobilise example is a really good one, because we've proven already we've mobilised 696 nurses in the community with tablet devices and the ability to connect to a clinical system in the community, so they're not reliant on paper. But what we've been able to prove, not necessarily at this moment in time, a return on investment, which is the tricky part, which is where you got the organisation to back funding and transformation to then, continue digitisation. There's always that delay from investment to return on investment that the organisations need to be aware of. You need to trust in what the systems are going to do, and trust in the national and regional and local strategies to digitise and connect. This system digitises and connects, and therefore it informs, and it is proven to improve morale, reduce stress, and increase productivity. So more nurses are able to see more patients every day. And so therefore there has to be savings from that. Ultimately, there has to be efficiencies from that, and it will address the workforce gap, because if you make your existing employees happier and more productive, then it takes, it's less reliance on that supplementary resource potentially in the future.
I think that's absolutely spot on. And something else that we heard, didn't we, last month, I think, from colleagues, was our pilot into voice to text dictation, saving some of our community child safeguarding team an awful lot of time. And that's something that we're still testing and hopefully going to look to roll out further. And just going back to Rio, because that is our big patient record, isn't it, within the trust, and it's massively important. And I wonder, Martyn, within the strategy, we address this, but there's a big piece of work going on now with regards to that we're calling our Rio Workflow piece. And I think staff would like to hear a bit about that, because that has the potential to really, really improve their own efficiencies, their ability to use the systems, and make care for our patients better.
Yeah, I'll do it in as simplistic terms as possible. Essentially, there was lots of stuff in Rio that could be done to make everyone's lives easier that use the system that hadn't been set up yet. So lots of bits of system functionality that can help everyone on their day-to-day activity that was free of charge. It was part of the main system that our teams hadn't been trained in and hadn't configured yet. So, for example, things like alerting, where it pops up and it tells you what the main alerting is proactively, and you can configure that to set that up. Screens that tell you what your referral to treatment time targets are looking like and who the priority service users are to get back in contact with. Screens that tell you what your to-do list is looking like, and your ability to transfer internally, make a referral internally for a service user from one team to another when you're both using Rio, as opposed to jumping out of that system and writing a paper document or a Word document and sending an email. So there's lots of bits in Rio that we intend to turn on, configure, try out, and make what we're calling that exemplar pathway using the system. But in reality, what it means is there's going to be lots of training opportunities and lots of new system features that will make everyone's lives easier, and again, reduce stress, make people more productive and happier using the platform.
And I guess there'll be people perhaps listening to this who probably thinking, well, we haven't got Rio in our services, and when are we going to get Rio? And I guess that's part of the strategy, and the ambition is to get that one EPR system across the trust. So I guess it's just giving reassurance to any listeners around that, really, that we are looking at what we can do, the art of the possible with Rio. What can Rio do? So we're maximizing what we've already got, and that's really important. But also for those who perhaps aren't on an EPR system, or perhaps are on a different system, there's work going on around, centralizing that and moving to one EPR system. I think in terms of the wellbeing as well, offer, we talk a lot about wellbeing. There's lots of different resource out there for people, but I think wellbeing is stopping that frustration, isn't it? It's stopping that emotional labor, and I think digital fatigue has to be recognized as well moving forward. And the better we make the systems, the more user friendly, the more efficient we make them, and that's what Rio Workflow is about. Ultimately impacts on well-being as well. So I think it's a really good project. Sorry, Matt, go on.
No, that's all right. I was just going to come in. I guess what we're saying is we're looking to streamline along with digitize. We are digitizing things that may not be digital, but we're looking at a digital offer and making sure that we're not overwhelming staff with too much. And one of the things we're looking to do in the not too distant future is reduce the number of email addresses that we all have, because we've heard that loud and clear from staff. They don't like having multiple ways of people contacting them because they can't keep track of it. So we've ensured that our own domain, our MPFT domain, is secure, so it has all the same functionality that NHS Mail does, and we're hoping to move away from NHS Mail and just use that in-house, which then reduces that kind of digital fatigue that people are feeling. And again, with that theme of looking to use digital to improve efficiency, but improve staff wellbeing and morale. Because what we don't want to do is add a work burden by digitizing everything. And that comes through loud and clear in the strategy for me too.
Yeah, because one of the things there was around, they said, you've digitized some areas, but now you need to make it reliable. And that, that fatigue from that. So what you mentioned earlier, Steve, I used to come out with a rubbish analogy, but it was quite an effective one with the engagement sessions, which is, if you gave me a car that broke down every 5 miles, I probably wouldn't want to drive it very often either, and that is essentially maybe a Lamborghini, but if it breaks down every 5 miles, it's a great car, but it's not very effective. And that's where that infrastructure reliability comes in, and the workforce wellbeing, because actually it's like confidence in the system, confidence in your own ability to use it with the skills that we have. And again, I was a confident driver, but when my car broke down, I wasn't confident in the car itself. So there's two levels of confidence we need to gain here from our service users and our staff in using these things. And absolutely it helps well-being, because one of the most stressful things you can have is an unreliable something, which you need to depend upon.
And I think, sorry, Martyn, just to cut across you there, but you mentioned the analogy of the driver and the car. And I think we're also doing stuff about the driver, if you like. Trish Nolan is working on this digital upskilling piece of work to support the staff. So we're saying to everybody, look, we're looking to improve digital across the trust, but there will be some amongst you that find this a bit overwhelming and a bit intimidating. And we haven't forgotten about that. So running through this is the ambition to get people trained up and supported by the trust to feel comfortable and confident in using these systems, so that you can better do the job that you want to do. Is that fair, Martyn?
Yeah, 100%. And for our service users throughout the strategy as well, where digital is not appropriate, we will not force it on our service users. We'll be flexible in our approach. So for those where it is suitable, that releases capacity to have more tailored approaches for those where digital is not suitable. So, for example, if there's a phone line that is currently being absolutely hammered with calls right now, and we do something clever with digital, which is like an online chatbot where you can do your own referral or cancel your own appointment, and that works for 50% of our service users, and they like using the website, that releases 50% of the capacity on the phone line. So if you don't like using the website, you're more likely to get through faster and speak to someone to manage your own care and to get the support you need. So that's the principle throughout the strategy as well.
And I guess that kind of links in with the data, because data, as we know, isn't always reliable. The strategy does outline work around making our data more reliable, more available to staff, connecting staff and informing a direction of travel. And I think as we mature through the digital strategy, our data will become more mature, and it'll lead us into a direction that we need to go in. And I think that digital data that we gather from systems is essential, isn't it, really, in terms of informing that direction. So we must get that right. So, and I think that comes with the training as well, because we know that staff perhaps you haven't got time to input everything on a form. But I guess the importance of that is the back end is let's get our data right. So as that becomes more in the forefront of our minds, I think it'll help inform our direction of travel as well. So I think data is key moving forward. I don't know what you think, Matt.
Yeah, you're absolutely right. And as you both will know, but the rest of the organisation may not, we've recently procured a new kind of business intelligence platform so that we can better manage our data. And data comes in all sorts. I mean, we've talked about our patients, and what we need to understand in terms of data from our patients is which ones of our patients are comfortable using digital. And this is an arm of the strategy, so that we make sure we are digitally inclusive. But as Martyn says, this isn't saying it's digital at all costs, but digital is a tool in the toolkit of the clinicians, and where it's appropriate to use we will. But you mentioned something about inputting data, and that comes a bit back to the Rio Workflow, I think, which is where we're building forms for data to go in. We can make these intelligent. We can use things like conditional logic to make clinicians have to put in less data and make that easy, but then make the data that we pull out very, very appropriate to look at for services to think about how they might configure themselves to get the best output for patients in the future. Is that right, Martyn, do you think?
Yeah, and just really briefly to explain that conditional logic for those that might not know.
Thanks,
it's okay.
I do know what, but it's a good point.
Yeah, I was thinking primarily of yourself, Steve, to explain it. Yeah. So back in the day when you had paper forms, you could ignore the fields or strike through the fields that weren't relevant. And then we've had many bits of feedback where we said when we've digitized something that replicates the paper form, and then that can often result in lots and lots of questions being presented to people that you have to wade through on a digital system that aren't particularly relevant. So, for example, if you tick on a form, date of birth, and the date of birth is under 18 years of age, then the field would appear that said, parental consent obtained. Whereas if your date of birth is over, you wouldn't be prompted about is parental consent required. So that's just one example where you can actually make your forms more efficient by using data already submitted to inform whether further questions in that area should be asked or not. And that's something where when we've digitized, we don't want to digitize as is processes. We actually want to make things better as we digitize. And that's where that informing through data is great, but we don't want to put an unnecessary overhead and burden on the service users, because we don't want to turn carers and clinicians into typists and administrators. We want to release time to improve care and not just feed the system.
And I guess, this just data, I know we talk about data, but I guess for some people, what does that mean? And I guess, what it means is, when we look at graphs and charts, the data that's produced from these systems can actually predict an event or something occurring. And I guess that's the message, isn't it? That's why we need to get data right. If we input correctly and we create systems that are user friendly and designed for the user or the clinician, then we're going to get better data, which is then going to inform better decision making. So I guess I'm just trying to sum it up really around that data, because I think it is essential that we get that piece right. And like Matt said, we've got more systems coming on board now, which will help us analyze and present that data. So clinicians will be able to see at a glance the likelihood of something happening or the likelihood of this occurring, which we've never really got a grasp on, I don't think. And I think the digital strategy really puts a plan in place of addressing that. So I'm really excited about the business intelligence bit and the data bit, because I think that is going to be key and underpin a lot of the decision making moving forward. But I don't know whether anyone else has got anything else to add on that. We've been talking now for quite a few minutes.
Just briefly, just on the data point really quickly, if the rest of the strategy is as successful as we hope it to be, that volume of data is going to exponentially increase, because we want to add in additional remote monitoring devices that's going to collect data and bring it into the system. We want to connect to the systems together. So you mentioned about Rio being the primary electronic health record. Absolutely. But where systems that are still in use at the moment can't be for certain reasons, like our sexual health system, we'll always have a separate sexual health system, and a dental system, probably a separate dental system. but the amount of data that we're collecting from those is going to increase as well. And we want to find ways of securely positioning that pots of data so that we can use it to make decision making, as you say. So, but yeah, with the Internet of Things and these remote monitoring devices which can all connect to the internet and do blood pressure readings and temperature and pulse rate, all of those can feed into our clinical system as well, hopefully in 5 years time, generating 10 times more data than we are right now. So it's really important to be able to summarize that and make it as easy as possible for people to look at it and make decisions from it.
Brilliant.
And I think, we've talked a lot about the strategy. I think it's fair to say that all of us that have been engaged with it are really excited to see what this will deliver. I'm really positive about it. I think it addresses all of the things that we would want for both ourselves as staff, but also for our patients, and it has the ability to really make the lives of our patients better and healthier. And I guess a plea from me probably to our listeners is to please engage with us. So if there are things that you would like to ask questions about, comment on, ask us to consider, then do get in touch. And you've got all of our names at the start of this, and you can contact us through the trust or through the various social media that this will be posted out on. But the strength of this is the engagement with the wider trust to make sure that we continue to make it work for you. This isn't a document for 5 years and we leave it alone. It's going to be dynamic. We're going to be able to review this and look at our priorities as we move forwards. And I think, I don't know if Martyn, Steve, you'd agree, but that is the key. We want our staff and our patients to engage with us through this and let us know what is working and what isn't working for them.
Brilliant. Thanks, guys. It's been great chatting.
Excellent. Thanks for having me. You're really nice. I'll come again.